Hey everyone, so today in this video I'm going to do a 2-week Wellchild visit update. If you watched my last video, I did a 2-week postpartum update talking about, him, the baby, and as well as myself, and just like general things happening in the second week of having this third baby. I was going to do a update on his Wellchild visit because I was filming before his Wellchild visit and I was going to film after, but it's been several days since his Wellchild visit that and after editing that video, it was really long, and I think this video the update is going to be long as well, so I'm going to split it up into 2 videos. Anyway, so in terms of his growth, he's growing fantastically, I think, in my opinion. At the 2-week mark, at the 2-week Wellchild visit, they want to see that the baby regain their birth weight. So when they're born, they tend to lose weight. They don't want the baby to lose more than 10% of their weight. He only lost 4% at his, I think, 1-week Wellchild visit, or his first couple of days, I forget which one it was, but he only lost about 4%, so he was well within the range. And at his 2-week, which was a few days ago, he had regained his birth weight, as like I said, they're looking for, and actually more. So he's actually more than a ½ pound over his birth weight as of a few days ago. He also grew 2 inches, which I don't know if they're looking for a certain percentage of inches. I don't think they are. I think they're just looking at weight. Which means, but 2 inches, I think that's a lot within 2 weeks. I don't know. They probably grow really fast, but I thought it was, really good because I think that weight regain is always a concern with my previous two children, or my older two kids. And I don't know if that's a boy thing, or if because I can, breastfeeding is not as difficult as the first 2 times around. So that is really good. So I think his growth is perfectly good and fine and things like that. Then when the doctor was checking him out, she noticed, and this is kind of why it took me so long to film this update, just because I've just been thinking about it ever since the Wellchild visit, and it's just been kind of, I guess, bumming me out a little bit and kind of worrying me a little bit, and I've been doing a lot of Google searching and things like that, and I really just hate that, and I'm getting very in my head. But when the doctor came in to check him out, she was saying she was happy with all of his growth in terms of head circumference, length, weight, things like that. But when she looked at his eyes, she said that, or was concerned that his eyes were kind of yellow. And this has to go back to the whole jaundice worry. And I thought we were past the whole jaundice worry. Usually, at least in my experience with my older 2, the jaundice was worry because they were yellow, their skin was mostly yellow, and the weight gain was borderline or whatever, but then they ended up being okay. For him, it's at the 2-week mark, and he's ½ pound over his birth weight, and yet she was concerned about the yellow in his eyes. So apparently jaundice isn't that, first couple of days, it isn't even the first couple of weeks, or it isn't even the first week. There's different kinds of jaundice. So the kind of jaundice that I knew of with my older ones is when, their skin, I guess their eyes can also be yellow, but it has to do with, generally has to do with they're not gaining enough weight, and they're not gaining enough weight, and maybe they're not eating enough or whatever, and tends to be with breastfed kids, kind of, maybe, just because are you feeding them enough, are you producing enough milk, blah blah blah. So that's called physiologic jaundice. And then I'm looking at my phone and just to, so, and I was reading this article from American Family Physician, which was, I think, published in 2002. Hyperbilirubinemia is one of the most common problems encountered in term newborns. Historically, management guidelines were derived from studies on bilirubin toxicity in infants with hemolytic disease. More recent recommendations support the use of less intensive therapy in healthy term newborns with jaundice. Phototherapy should be instituted when the total serum bilirubin level is at or above 15 milligrams per deciliter in infants 25 to 48 hours old. 18 milligrams per deciliter in infants 49 to 72 hours old, and 20 milligrams per deciliter in infants older than 72 hours. So 2 weeks older than 72 hours, they're looking at 20 milligrams per deciliter. Few term babies with hyperbilirubinemia have serious underlying pathology. Cross your fingers, that's good. Jaundice is considered pathologic if it presents within the first 24 hours of birth, which wasn't much of a concern for him. The total serum bilirubin level rises by more than 5 milligrams per deciliter per day, or is higher than 17 milligrams per deciliter, or an infant has signs and symptoms suggestive of serious illness. So he has not been above 17 and doesn't seem to show any signs of serious illness. The management goals are to exclude pathologic causes of hyperbilirubinemia and initiate treatment to prevent bilirubin neurotoxicity. So it has to, you know, I'm learning that the like too much bilirubin in the blood is, you know, can have brain damage. So reading the risk factors from this article, on the maternal factors, breastfeeding is one of them, which high. Ethnicity, Asian or Native American, hello. And then there's some others which don't apply to me. And then the neonatal factors include birth trauma, no. Drugs, no. Excessive weight loss after birth, no. Infections, infrequent feedings, no. Male gender, yes. And previous sibling with hyperbilirubinemia. So I would say probably no, but the fact that he's male is one of the factors. And so there's the physiologic jaundice, which happens generally within the first few days or within the first week. And then there's this new thing called jaundice and breastfeeding. There's called early onset breastfeeding jaundice. And that is because of relative caloric deprivation in the first few days of life, which is not his case because he didn't lose weight. And then there is late onset breast milk jaundice. So the first one is called breastfeeding jaundice, which has to do with like you're not feeding them enough. But then there's breast milk jaundice, which happens a little bit later, and it has to do with just the breast milk itself. And you're like, you know, wait a minute, like breast is best, you know, breast milk is, you know, Trump's formula or whatever. And I'm not saying that like, you know, people who feed their kids with formula is bad. I mean, my first one was half formula, half breastfeeding. But I don't know. I work so hard to kind of like to do the breastfeeding thing. You go through a lot of pain, you like plow through it just because you want to give them, or at least I do, want to give them the breast milk. But now I am reading that there's this thing called late onset breast milk jaundice. So it occurs later in the newborn period, with bilirubin levels usually peaking in the 6th to 14th day of life. This late onset jaundice may develop in up to 1/3 of healthy breastfed infants. Total serum bilirubin levels vary from 12 to 20 and are non-pathologic. So she redid a bilirubin test at the 2-week Wellchild visit, and he is within that range. So I'm hoping that it's not pathologic. When we got the test results, On the comments of the test results, she wrote that she would like to see him in 2 to 3 days, or have him redo the test in 2 to 3 days. And then later she emailed me saying that she consulted with some of her colleagues, and the colleagues said that it'd be okay for him to come at the 1 month. And we were originally going to skip the 1 month because the 1 month is optional. So basically in 2 weeks time, she wants me to retest his bilirubin levels. And then it says bilirubin usually falls continually after the infant is 2 weeks old, but it may remain persistently elevated for 1 to 3 months. So 1 to 3 months, yeah. So up to 12 weeks that I've been reading, that he can have these elevated. So I don't know if I'm going to have to repeat these tests every 2 weeks or how often until he's 12 weeks old. I don't know. The doctor said that I should be looking out for his stools, that they're not white or clay colored, and that he's not acting, I don't know, sickly, I don't know, like weird, I don't know. And then it says, if the diagnosis of breast milk jaundice is in doubt, or the total serum bilirubin level becomes markedly elevated, breastfeeding may be temporarily interrupted, although the mother should continue to express breast milk to maintain production. With formula substitution, the total bilirubin level should decline rapidly over 48 hours. Confirming the diagnosis, breastfeeding may then resume. My doctor was telling me at the 2 week visit that for 24 hours I would have to stop breastfeeding for 24 hours if it is too high, and then it should go back down. And I was like, I was just thinking the worst, or just trying to prepare myself and trying to be like, okay, wait, because she was saying like he might need to go to the hospital that day, that night, and get phototherapy, or we might have to do a stop breastfeeding for 24 hours and just do formula. So because apparently there's some unknown things in breast milk, or unknown factors in breast milk that might be causing the jaundice. So that was kind of bumming me out because I really don't want to pump, honestly. I think the breastfeeding is going really well and his weight gain shows it. And it's just, I've just been really bummed out about this. And but she took it back, so she wants me to come back in basically 2 weeks. So that's what I've been waiting for. I'm trying to read as much as possible. This article is really good because it pretty much says what all the other articles says, and it's written very well, although it did say 48 hours versus some say they only have to stop for 24 hours. But yeah, I don't want to have to pump, and I don't want him to have formula. And it's like, this is a case where, wait a minute, breast is not best. This is stupid jaundice. Like, I'm so sick of this jaundice. It's just like, I thought I got past the jaundice thing because his weight gain was good within the first week, but I guess apparently not. There's always something, right? Yeah, so I'm constantly looking at his eyes to see and hope that it doesn't get more yellow, or that I'm hoping that it just gets less yellow, honestly. And yeah, so that is basically the 2 week Wellchild update. I'm really bummed out about it. I haven't been able to film the past couple of days just because I've just been thinking about it so much. And the other thing that she told me in at the visit, she was like, oh, maybe you should maybe it would be a good idea to introduce him to a bottle, which I was surprised about because I don't think she said that with my second baby. And she did see my second baby from the beginning, because if later down the line, if he does need the bottle, he might refuse the bottle. You might have like problems like giving him the bottle and blah blah. So she was like, maybe it is a good idea. She's like, you should consider giving him the bottle every once in a while, just so he doesn't refuse it later if you have to go bottle feed later. And that is also something that was kind of like shock to me, I guess. I don't know, like something, well, it's basically something that I don't want to do. Like with my second baby, she never took a bottle, she never needed a bottle, and I feel like at 6 months she went straight to sippy cup. So I feel like I just don't want to do the bottle thing, and I don't want to do the pumping thing if I can help it. I mean, I'm probably gonna have to do the pumping thing later at the second half of the first year, because, you know, going back to work, you have to pump. But I'd like to hold off on pumping as long as I can. I'd like to not use the bottle if I can, just go straight to sippy cup. It just, in my opinion, it's just easier, better. I don't know, just something that I prefer. So that is his update on the 2-week Wellchild visit. I'll have another update in another 2 weeks to see how his jaundice is doing. And that is basically it. Please thumbs up this video if you'd enjoyed it. Leave a comment down below if you have recommendations on or if you have video requests on what videos that you want to see. I am trying to do more vlogs. Well, this is one of the things, like, I don't understand like why I stopped vlogging, and now I have like a kind of desire, like strong desire slash drive to want to do it, but I see myself not doing it because I don't have hands. I just don't have hands, or I forget, and I remember when it's a little too late, and things like that. I did do a video on another what I ate video, and I forgot 2 of the snacks that I had. I forgot to film them, so I'm wondering if I should even upload it, but I probably will. So yeah, I do want to try to do more vlogging. I like both. I like vlogging and also like these kind of sit down videos, like talk to you videos, but I'm just realizing like how hard it is to, like, you really just have to be really adamant about it and remember about it all the time. And with 3 kids, it's just sometimes hard. Like, sometimes I forget. Anyway, please subscribe if you're not subscribed already. I'm a whole big mess. This is baby number 3, and just hope that he gets better. Hope that his liver works better, that his jaundice gets better, that he doesn't have to get phototherapy or doesn't have to do formula just for this jaundice. And yeah, he's a cute little guy. Aren't you? He loves sleeping on me. And anyway, thanks for watching, and I'll see you in my next video. Bye.